I've lived in a large body my entire life. I've had a lifetime of ridicule, bullying, being put down, being discriminated against, being stereotyped as being lazy or lacking in willpower or dirty or sloppy. Diet after diet after diet. All that shame and blame that I got, I turned it inward. I became my own worst bully. I would say things to myself that were so incredibly negative that I'd never say them to any other person, ever. Weight bias is woven into the fabric of our society, and it's a thread we need to pull out.
So we just watched a video from a woman by the name of Patty. And if you paid attention to the words Patty said, she really highlighted the complexities of obesity. She allowed us to try to understand the importance of shifting our perspectives. So a very engaging story from Patty, a very impactful story from Patty, who you just watched this video from. I'm Karen Campbell. I work for WTHR Channel 13. I am excited to be here today to be a part of this event today. I want to introduce our next guests. They are distinguished leaders. They're making significant strides in improving obesity care through their work. So please help me welcome Joe Nadglowski, CEO of the Obesity Action Coalition, and Dr. Robyn Pashby, Director of Health Psychology Partners. So before we get into questioning, again, we want to focus on some of the things that Patty talked about. I'll have you start.
Yeah, so, if we were all here talking about, they're going to bring me a handheld, I think, because this mic's acting up. If we're here talking about cancer, I think we'd all agree that cancer is bad, but we have compassion for people with cancer. But we're here talking about obesity, right? And somehow in our world where we made obesity bad, we've made the people with obesity bad as well. And I will tell you, it's a major issue, and we're going to talk about it now. This kind of attitudes, negative attitudes that we have towards people with obesity are harming people. It is keeping people from getting the help that they need. But I also want to be very clear that we are not going to solve blame and shame about people, blame and shame towards people with obesity by blaming and shaming the people who are engaging in that behavior, right? We have to start by changing people's hearts and minds. And so that's my goal today. When you hear us talking today, some of you might actually see yourself in some of these behaviors, whether it's you've internalized the bias you've received, or maybe you've delivered some bias. And our goal today is not to blame and shame you about that. I believe that most bias towards people with obesity is unintentional. I have an optimistic view of this world. I don't think most people are cruel, but I think society has told us that, hey, if I make fun of you, that's going to motivate you to address your obesity. And the reality is 90+% of the time, the opposite is true. If you stigmatize someone because of their body weight, they're going to gain weight, not lose weight, because what do? They turn back to some of those behaviors that might have contributed to their obesity in the first place. So I wanted to start off that way, just to recognize that this conversation isn't always easy. And again, it is not our intent to blame and shame anyone, but we just hope you learn from this experience today. So thank you very much.
Yeah, sure. Robyn, I want to start with you, or actually both of you. We know you're experts in bias and in stigma. You both have experienced both of these. Talk to us about why people show or feel biased against people living with obesity when that's not necessarily the case with any other disease.
Well, I think the most obvious answer is that you wear your disease. So when I look around here today, everyone's wearing business casual clothing, right? We know what's expected of us and we show up accordingly. If I sat up here today with my education, my experience, but I was wearing shorts and a t-shirt, you couldn't help it. You would think things about me that might not be true. You would think I didn't respect this group. You would think that maybe I was lazy, disorganized. You might think that I didn't care about what I'm doing right now. So I want to share that example because it's something you can relate to. When you got dressed this morning, you tried to present yourself in a particular way to the people in this room. When you live with obesity, you don't always have that option. People are going to perceive you based on their own history, their own experiences, the messages they've been told.
I'll add that, and you heard Patrick Johnson this morning talk about the image gallery that we worked on, that this is how the media and the public portrays people with obesity, right? We have data that shows this. So if you are normal weight and you're featured in a picture around a news article, you're almost always shown in professional clothing. But if you are actually someone living with obesity, you're shown dressing slovenly, right? Even when I was bigger than I am today, I still would have been in front of you looking like I do today in the clothing I would not have been dressed that way. The other thing that we see, not to pick on your colleagues, is that we have the tendency to depersonalize this issue. So think about all the news articles you've seen recently about obesity. Almost always the person depicted is shown without their head. So we've actually, you might say, well, that's to protect their privacy. Well, I guarantee you that if you were showing my body, I would know that was my body. But I would just remind you that we've turned those people into inanimate objects instead of real people. We've taken away the compassion and empathy we might show that there as well. So I think that's another important factor when it comes to these kind of issues.
Yeah, that is so true. I mean, I can attest, again, working in media, you hear a story about obesity, and that is true. I've always been told, oh yeah, it is to protect their identity, but that's not necessarily the case. So, what are some biases that people living with obesity may experience?
Well, one of the things that I think we have to recognize quite clearly, and I'll use this from my own personal experience, no one in the public has said worse things about me than I've said about myself, right, kind of thing. And actually overcoming what we call this internalized bias that we've internalized, accepted, we've heard all these things from the public. It really impacts people, and it dramatically impacts people, and I think Dr. Pashby can talk about that quite clearly as she sees with her patients. But I will tell you, it is the real part of this, and honestly, it continues to be a struggle for me personally, and most people who struggle with this. Even though now I'm in a smaller body, my annual checkup is coming up, and I'm scared about my doctor belittling me about my weight, even though my weight is less than it used to be, right, kind of thing. And because I've internalized all those views, and by the way, all those past experiences I've had with providers who have said such terrible things to me. Look, obesity has to be addressed in a healthcare environment. That's my strong belief. We should stop making people go out and do this on their own. However, we have to recognize that most of us in the healthcare environment have had terrible experiences with our healthcare providers. And I know there's good providers in this room and good providers out there, and a good provider set me on a journey towards better health. But the vast majority of providers simply just, Joe, you need to lose 20 pounds. And they wag their finger at me, and they send me on my way. And I'm like, no bleep, doc. I've known that for a long time. Help me, right? Help me do that. And that's what we need now, more than just the blame and shame.
Well, and what stands out to me, Joe, in that story is that you go back to your doctor. Because what I see in my practice, I'm a clinical psychologist, see patients all day, every day, living with obesity. And the story that I hear mostly is I don't go to the doctor anymore. I wait. I certainly, as a woman living with obesity, avoid things like routine pelvic exams, mammograms, things that are already shaming and vulnerable for some. But I'm not even gonna go to address things like knee pain, shoulder pain, sore throats, because often when I do, I leave with a pamphlet about metabolic surgery or told, you gotta eat less and move more. And I think about this a lot with my patients and just in general, and I think that there's two things that stand out. So Dr. DeMarchi talked about Christ and how we sort of play this role. But from the beginning of time, gluttony was a sin, right? And so baked into our culture is this idea that you're bad if you engage in what society would call gluttony, overeating, overindulging. Of course, the limited, simplistic bias we have about obesity is that you eat too much, right? And then you layer that on top of what I call the bootstrapping bias, this idea, the American dream, that no matter where you come from or what you're struggling with, if you just work hard enough, if you just commit your effort and your energy, and you stay morally correct, you will succeed. This doesn't work in economics, and it certainly doesn't work in health and medicine. And yet, it's part of the fabric of how we do things here in the United States.
You know, I think in thinking of Dr. Pashby's comments there, I think about, and especially hearing Dr. DeMarchi talk this morning, an amazing talk. I think about, from my perspective as a person who uses one of the therapies that he helped develop, is a very different view, because I actually don't see these medicines helping me eat less. I see these medicines making me resist the noise of such foods. And some of you who know me have heard me tell the story, but I was actually in New York City not long ago, and I had to walk 14 blocks to give a talk. I live in the country in Thonotosassa, Florida, super quiet. I don't hear noise. So New York's crazy to me when I go there, right, kind of thing. But I told people it was the most peaceful walk I'd ever had. I walked the 14 blocks to this meeting. And first of all, because my knees didn't hurt. By the way, the main reason why I sought treatment for my obesity is because of my knee osteoarthritis. But the second was, I wasn't thinking about all the food around me as I took that walk. I'm in New York City, and it's just block after block after block of amazing restaurants, right? And I didn't think about the food, right? There was no food, what we call, in the patient community, what we call food noise. And that was a remarkable thing for me, because I had the most peaceful walk I'd ever had, because I didn't have pain and I didn't have the noise. And I'm like, this is what it must feel like to be someone who doesn't struggle with this issue, right, kind of thing. And again, just understanding that, right? It's not, I recognize at certain points in my life I've eaten too much, but why did I eat too much, right? And I think that becomes the core thing. And maybe one of the things as we do further research around these remarkable medicines that are starting to help people, to really try to understand that, again, I'm going to be very simplistic here and maybe very bold here. It's amazing to me that we have a medicine that makes food marketing not work, right, kind of thing. And I think that's, from many of us in the patient community, that's how we're feeling right now.
So I wanted to go back to two things. First, I'll start with you all were talking about going to the doctor, right? How some professionals would discourage people living with obesity of going to the doctor. What other fears do they share?
Yeah, there's lots of fears. Now, I'm just going to, again, I'll use my personal experience and then Robyn can share. So those of us who live with obesity, I guarantee you, every person who lives with obesity remembers the first time a doctor talked to them about their weight. And it is likely not a positive experience. Mine, I was almost 21 years old. Amazing to say this, but my wife now, girlfriend at the time, knew I had an allergy problem, and she dragged me to the doctor, again, something I didn't like to go to do. She dragged me to the doctor to get this. And I'm old school, nurse has my shirt off, she's pricking my back to decide, what things I'm allergic to. And the allergist of all people, who I hadn't seen that day, walks in, looks at me, Joe, you could lose 20 pounds, wags his finger at me, turns around, walks out of the room. That's it, that's all he told me. But the reality is that has influenced every visit I've had with a provider before. I'm like, is the first thing a doctor going to do is judge me based on my weight instead of having a real conversation with me based on my health issues? And it is jaded every visit since. Like it takes me courage. It takes me working up courage to go and engage with a provider. And again, there's lots of negative experiences since that point, and then some positive ones as well. So as I mentioned earlier, I don't want to say everyone has been negative, but it really does keep people from getting the help they need. And I have to remember, in this country, there's a stigma around obesity, but there's also a stigma around needing help for your obesity. Lots of people, including someone who I just met in the lobby of the hotel this morning, was talking about how, well, gosh, I don't think people should use medicines or surgery to address their obesity. And by the way, this is a healthcare provider who was here for another meeting. And I'm like, well, wait a second, let me tell you my experience. Do you still feel that way after this, right, kind of thing? And that's the reality, right? So there are many providers, again, look, he's like, well, we need to fix the environment, and people need to be active more. And I agree with all that. I've been working 20 years to do that in my role. But sometimes we need a little more help than that, and providers can deliver that, but unfortunately too many of them think about that. And I know, Robyn, you could share tons of experiences from your patients.
So just to sort of lighten things up a little, I think about your mothers. Just a second. Just think about your mom. You know how your mom can give you a look and it tells you everything you need to know? Everybody has a mom like that. I am a mom now and I give that look. When I think about what patients fear living with obesity, I think about moms. Because what does a mom want? We just want our kids to be okay, right? We want our kids to be healthy and happy and good citizens of the world. But we worry, pretty much incessantly, we worry. But what we communicate sometimes when we're feeling anxious or we're in uncharted territory is like, watch out for that, right? Don't do that, do this instead. And I think that if you think about how much is communicated in that look from your mom, people living with obesity feel that look of judgment, you're doing the wrong thing, this is the right way, do it the other way, from their employers, from their siblings, from their moms and dads, from their doctors, from the media, from the elevator bellman, right? Patients living with obesity, going to the grocery store, something maybe none of us love to do, but we do maybe without fear. Imagine living in a larger body and pushing your shopping cart around the day before your kid's soccer game. And you're loading it up with, I don't know, snacks, goldfish, and some popsicles and things like that. But you live with obesity. Imagine what the person in line in front of you thinks when they look in your grocery cart, because I promise you, they look. So think about how every single thing you do, all day, every day, is affected by your body size. I get tickets to a show at the Kennedy Center. I live in Washington, D.C. If I'm bringing my mom who lives with obesity, the first question she asks is what? Will I fit in the seat? Not what show are we going to? Will I fit in the seat? So think about that on the metro, in the cab, in the doctor's office waiting room, at this venue, right? If I will sit in the seat, will it hold me the whole time? These are questions people live with every day.
And to make it more complicated, I think, the example I often give is someone could walk through this room right now and weigh 400 pounds. And I will tell you that if you are not their personal healthcare provider, you can tell nothing about their health. Because maybe a year earlier, they weighed 500 pounds. They've done something remarkable, which is maintain a 100-pound weight loss. They may be the healthiest they've ever been. Yet society would say, this person's a failure. When we should be celebrating the fact that they're working towards the best health they can achieve. And that's what makes this so hard, right? That's why the stigma exists, right? Because we have a tendency to judge it based on body size and body shape, instead of really showing people compassion and empathy and trying to understand what really is going on in their lives.
Exactly, and I know social media plays a critical role in this. So I also work in the fitness world. I have friends who teach, if anyone's familiar with Zumba fitness. I have overweight friends who teach Zumba. They're great at it. They have so many people coming out taking their classes, but on social media, they get these negative messages. How can she teach Zumba? Is she going to be any good? And those kind of messages just stick in your brain, which is hard to get those negative voices out of your head.
So it's hard for the patients or the people living with obesity, but I also think it's hard for the people sitting in this room, because it's a really delicate balance we're walking here. So I can tell the story of a patient I've been treating for a long time. She's maintained a significant weight loss, but still lives with obesity. And she finally, after maybe about 30 years, worked up the courage to go to her community center fitness class. And when she walked in, she's a woman in her 60s, lives in a larger body, but healthy, very well-treated obesity. And the fitness instructor said, "Oh, welcome in." And then as she started working out, the fitness instructor came over and said, "You are doing such an amazing job. Look at you go," with all this shock and awe. My patient never went back, right? So that fitness instructor, I believe, was trying to be encouraging and helpful and supportive, but it landed as patronizing and embarrassing and singling out, right? My patient said, "Would she have said that to me if I lived in what she called a straight body?" Probably not, right? So I think it's hard on both sides.
Yeah.
Right, and again, to my opening comment, right, it really shows how we believe most bias is unintentional, but you have to stop and think, would you say that? Would she have said that to someone who was of so-called normal size or healthy weight or whatever terminology you use, not recognizing that, again, you can be really well treated for your obesity and still be in a larger body. You know, the other thing we see, and we try to overcome this a little bit at our organization, which we're made up, our OEC is made up of people who live with obesity, and we bring people to fitness classes or exercise classes for the first time, and we try to bring diverse body size instructors intentionally, but in all cases they don't exist, right? But really to help people work up the courage to say, I want to engage in physical activity, right? And it surprised me. You know, we've seen progress in lots of areas, and there's some progress in the fitness industry, but there's more work to be done, right? Let's make this environment welcome. There's still Facebook pages and websites where they take pictures of larger people and larger bodies and make fun of them for going to the gym. Like, why would you do that? It doesn't make sense, but that's the world we live in today, right? If there's a larger person walking on the treadmill, we should be celebrating that, not making fun of them for engaging in that kind of activity.
Well, and this is the smallest thing, but I was at a gym in Washington, D.C. years ago, pre-COVID, and I was with a friend of mine who lives with obesity, and she sort of nudged me and said, "Look at this." And we were in the sort of the lobby area where they sell the t-shirts and water bottles, all the logoed gym things, and the largest size t-shirt went to XL. She said, "I'm a 2XL, so apparently they don't want me putting on a t-shirt with their logo." That's the message she got. So it was nothing that anyone said in the gym. The gym was accessible, all these things. But that one miss was a big one to her.
So what are some of the things that we can all do here today, or a message that we can take home to our family, friends, coworkers to really make an impact? What should we stop doing, or what should we do to help?
So I would just encourage all of you, next time you interact with someone in a larger body, just challenge yourself to think about what assumptions you've made, right? And maybe challenge those assumptions. You know, it's just easy to quick to judgment. Look, I flew here on an airplane, you know, I hear it every flight. You know, you see the larger person walking down the aisle, oh my gosh, I hope that person doesn't sit next to me, right, kind of thing. Instead of saying, you know what, if that person sat next to me, I'm going to try to accommodate them as best as possible and treat them with dignity and respect. So really challenge those assumptions you initially have. And then the other thing I would encourage you to do is to speak up when you see bias, but again, from the angle I suggested to you earlier, right? Which is, let's say, hey, you know, I was just at this amazing life sciences summit, and I learned a little bit more about obesity. And maybe it's not as simplistic as you're thinking when someone has made fun of someone, right? Or someone has stigmatized someone because of their body weight. And try to educate them to recognize that this issue is awfully complex. And I think what we know from the data is if someone understands obesity is complex, they are less likely to engage in weight bias and stigma. Is it perfect? No. But if they understand the complexity, they're less likely to do so.
I'll add that I think if we recognize that obesity affects people physically, we know this over time, but mentally as well. There is a very significant impact of living in a larger body in our society on people's mental health and well-being. I know I'm a psychologist, so I'm biased in this direction, but think about the times you have seen people say, you know, I started suffering with depression when I was 12 or 14 or 16, or I've had anxiety attacks my whole life. These are the kinds of things that come with the bias and the obesity stigma that exists in the world, and then people don't get help, not just for their disease of obesity, but for their mental health concerns either. And we talk about things like the economic burden of obesity, right? And whenever I hear that, I always think, oh, burden, right? Because patients feel like a burden to healthcare industries, a burden to their doctor, a burden to their family, a burden to the restaurant who needs to accommodate them not sitting in a booth because the table is attached and they can't make space for their bodies. A burden, a burden. And living with that sense of being a burden impacts someone's mental health significantly over time. So I think if we can start thinking about obesity as it affects physical, mental health, and of course relationships, then maybe we'll start to appreciate just how important these treatments are.
It's really important to really emphasize that mental health part of this. So Dr. DeMarchi showed that amazing data about the life-saving impact of bariatric surgery. But if we look at the bariatric surgery, there's only one place where it doesn't actually impact people's longevity, and that is we see a higher suicidality rate among bariatric surgery patients, almost 4 times the normal rate. And why is that? Because have we not addressed the mental side of this? Yes, we've addressed the cardiometabolic and all those other things. And that is, as we move forward, as we think about how we're going to continue to innovate around these treatments, we'll have these amazing interventions that will, help us lose weight and improve other health functions. But we can't forget we need that wraparound mental health care support around this. A lot of people we know who have lost significant amounts of weight do not recognize that they were stigmatized prior to that. They actually recognize it after they've lost the weight. And you know what? It's not a positive thing. Most of them get really angry about it. So if no one's ever held the door open for you because you have a larger body, when suddenly someone opens that for you, you might think that's cool the first time, but then after that you say, well, wait a second, I'm still the same person. Why wouldn't you hold the door open for me? And people have to cope with those kind of things. And it's really a struggle as we move forward. So there are balances here around the mental health side of this where stigma, the long-term effects of stigma, are not solved simply by just losing weight, right, kind of thing. We have to address those and help people move past those issues.
So I want to switch gears a little and talk about treatment, medication. It's come a long way over 20 plus years. Do you think the advancements in treatment are significant today, or would you consider treatments modest?
Well, I can tell you from a patient point of view, these are changing people's lives. Every day, patients walk into my office saying, I feel like I have a new lease on life, right? So maybe 15 years ago in practice, people would say things like, if I didn't think about my weight and food and did I eat too much or did I not eat enough, when will I have food again? When's the next meal coming? What will it be? What will I choose? All these things, they'll say, I think I could rule the world if I didn't have all my thoughts consumed by that. And now people are feeling a relief, like Joe talked about. So life-changing for sure. We still have a long way to go.
Yeah, and again, the terminology that's been used, game changers, I will say that they're game changers for those of us, and I'll talk more about this as we wrap up the day today, but they're game changers for those of us who have access to them. And that's a small portion of people, and we have to work on that, right? We have to build the system within our healthcare environment to care for everyone who has obesity and give them real legitimate care. But then we have to make sure our insurance coverage has access to those. If you're a state employee here in Indiana, you can access these medicines, but if you're a Medicaid recipient, you can't, right? And we have work to do around that. I'm Tampa, Florida based. For no amount of money can the Obesity Action Coalition buy health insurance that includes any obesity care for our employees. It's not offered to a small business. We would pay any amount of money. Okay, this is what we do. We would pay any amount of money for our employees to have access to this. We can't do it. I'm privileged enough, and I live with some guilt around this, I'm privileged enough to have the means to pay out of pocket for the medicine that I use. But by the way, we have to scramble to do that and I don't use ideal doses, right? I use less medicine, and I probably not the ideal way I should be cared for. And so, but that's the reality of what we have to do to make this work. And there are so many people out there right now that that's the world we live in. And again, mentioned by Patrick Johnson this morning, what's happened in this world is we've created classes of people, right? We have first-class citizens who have either money or access to good health insurance that have access, and we've created these second-class citizens who have to go to, maybe a sketchy place on the corner to find some version of this that got made in a basement. Maybe it was made in a legitimate place, but maybe it was made in the basement. Some people are going to the barber shop or the beauty salon and getting this, and there's no healthcare provider involved. It's crazy, but that's what people are having to turn to in this world because we haven't, there's such hope for these medicines, but there's so little access, and we have a lot of work to do, right? You definitely, these are serious medicines for a serious problem, which is obesity. These should not be taken in absence of care, right, kind of thing. You need to be cared for while you're taking these medicines, and so, not to pick on anyone here, but if anyone's getting their compounded GLP-1s at the beauty shop or the barber shop, and you're not engaged with a healthcare provider, my advice would be go engage with your healthcare provider and have a real conversation around them, because again, there are aspects to your obesity that are not just about losing weight, right? It's about adjusting other medicines you're on or dealing with side effects or looking for other long-term issues that are important.
But I'll just add, Joe, so one of the reasons people seek help from their barbershop or their beauty salon is for what we talked about a few minutes ago, right? Where you don't have to go see your doctor who might shame you, even unintentionally, or might say, well, let me see 6 months of you trying first. These sorts of arbitrary things. Right, so it's almost safer to go to your community where you're accepted just for who you are.
Yeah, I want to be bold here. I mean, this idea about making people try, I just want to be very clear. There is not a single person who's struggled with their weight who has not tried to lose weight at some point. This idea that you make me go on one last diet, this actually started in surgery, right? Insurance companies would make people go on one last diet. Why make someone go on one last diet when they've been on 30 diets in their lifetime? I've been in 17 behavioral programs in my lifetime to address my obesity. 17. If my insurance company made me go through one more, that's not it. Now, if they were designing a program for me that was specifically for people who are using these new medicines that actually taught me different behaviors, because it's not, by the way, you just can't bolt on an old diet program to one of these new medicines, right? You have to learn to eat in a different way. You have to learn to eat, in some cases, more food, not less food. You have to learn to engage in your physical activity in a different way. That would be a good thing, but most of these programs are, hey, just go on one last 6-month diet, right, kind of thing. And I don't know, I've been on a diet since I've been 20 years old. I don't need to be on one more diet. Right?
Yeah, can you talk about the complexities of that? Because, doctors will say, do this, do that. There's so many lose weight now, commercials that we see, but it is not that easy when the outside world may be looking at someone living with obesity saying, oh, all you have to do is, work out 5 times a week, just change your diet. Like you said, you've done that plenty of times, and it's hard. How can we make other people realize just how challenging that is? And it's not just saying, do this, do this, do that.
Well, I mean, as someone who doesn't like to be told what to do, it never really works for me when someone says, do this, do this, do this, don't do this. And I'm guessing because of the people sitting in this room, the education level you have and so forth, you're probably the same, right? It doesn't feel good to have someone tell you what to do. You're a grown person with your own autonomous ideas, beliefs, behaviors. So the very first thing I think is we should be encouraging people to have autonomy no matter what, so that they can seek treatment if they want it or not. But also giving people more education, like at events like this today, help push the idea that does nutrition matter? Of course it does. We're not up here pretending that nutrition isn't an important factor. Does movement matter? Of course it does. But so does sleep. So does social connections. So does environment. So does access to care. So does mental health. So does family impacts. All these other factors, right? And so I think people sort of know that intuitively in your own life. Have you ever tried to change a behavior? Of course you have. It's not always just so easy, right? right? And we're asking people to change lifestyles. It takes a lot of support.
You know, it's interesting because I'll just be frank here. I mean, every single one of us in this room has either lost weight or gained weight over a lifetime, right? Whether intentionally or unintentionally. That doesn't make every person in the world an expert on obesity, right? And I think in some of the messages we're hearing out there, people are too willing to trust a TikTok health coach versus a skilled healthcare provider around these things. And I think of the messaging right now that we're seeing out there, and especially around these new classes, these GLP-1s and the GLP-1 combinations. And you should not be getting advice from a TikTok expert around this. The only person you should be getting advice from is a skilled healthcare provider, right? And it's challenging right there. And too often, because of the way the system's set up, and again, because of the stigma that we've talked about all before, it just feels like it's safer for me to go to this TikTok health coach than it is for me to actually have a real conversation with a true expert around these issues.
Is there ever a concern for risk of harm for people living with disability? Harming themselves, potential suicide, we talked about, the impact social media can have. Is there ever risks to that?
Bluntly, weight stigma is trauma. When people live with internalized weight bias, as a psychologist, I conceptualize that as traumatic stress. And often it's lifelong traumatic stress. So I think as a society, we can all acknowledge that things like child abuse and neglect are horrible. That people who have to endure child abuse as a teen or as a young kid have lifelong consequences, right? But we don't seem to see weight stigma, that it often starts in families as traumatic stress. But let me assure you, it is. So people that live with trauma are much more likely to develop things like, obesity, addiction to drugs and alcohol, to complete suicide or engage in other self-harming behaviors, to have poor relationships in terms of less supportive relationships, maybe even abusive relationships as adults, to have lower levels of education and employment. These are all direct results of living with trauma. So if we start seeing weight bias and stigma as the trauma that it is, then we'll start to understand the severity of it and how it affects people's lives.
When we think about this, moving towards harm, show of hands, how many people have school-age children? Anyone have school-age children? Yeah. So anti-bullying materials, those have come home quite a bit, right? You all have probably seen the anti-bullying rules. I would challenge you to go back and take a look at them, because probably a 80% chance they have nothing about weight-based bullying in them. So weight-based bullying is so ingrained in our society that this is just normal, that in our anti-bullying materials, we don't even mention them, right, kind of thing. There's been more, children have received more harm from weight-based bullying than any of the other forms of bullying combined. There have been more deaths, et cetera, yet it's not mentioned in any of those materials. And if you are passionate advocates like I am, and we've inspired a few people to go actually talk to their school boards and get some of that information added, because the reality is that weight-based bullying is the original form of bullying, and it's doing a lot of harm, and it's really harming our kids.
Okay, just a few more questions for you all today. I want to get back to the topic of acceptance, right? That's a big word, acceptance of obesity. Where are we now? How do we get there?
So where my brain goes is in two separate directions with this, which is often the case. But on one hand, we have a whole body positivity movement, right? Fat acceptance movement, where people are trying to reclaim the word fat, reclaim the idea of living in a larger body as something that is to be heralded, that you shouldn't be ashamed of your body no matter what it looks like. And I am all for that. I 100% agree that when we learn to accept our bodies as they are, as they show up in this world, whether it's because of the size or because of our hair color or how much hair we have or whether we wear glasses, all of these types of things, that people in general feel better. But on the other hand, I think that there's a little bit of polarization because we like to categorize things, right? We like sort of good, bad, good versus evil. And I think on the other hand, the more we accept that obesity is a chronic disease, then we give people the ability to ask for help if they want it. And guess what? You can seek treatment and care for your obesity and still accept your body as it is. You can actually do both of those things.
It's been pretty remarkable, and again, I think credit to the new class of medications have really changed some of this perception, especially in the groups that were kind of the body positivity, fat acceptance groups, where they've, again, because the medicines, the way they work, it's not your intentional behaviors that caused you to have obesity, right? They're working on the biology, right? And so it's getting people to think differently about that. And actually, interesting, those movements are having some challenges operating around this. But to what Robyn shared, I think it's important to me how I put that in my layperson's terms is you have to love yourself to want to help yourself. And so I think it's important that we encourage people, to love their bodies no matter what their size is. And again, as I said earlier, and I think it's important to remember, not everyone who is successfully treated for their obesity is going to look like a Men's Health or a Women's Health cover model, right? There are going to be plenty of us who still live in larger bodies. And that's okay, right? And so I think we have to set expectations, and so we're gonna have to create some acceptance, right? The other thing when I think about acceptance is, and mentioned earlier by Robyn about seating and things like that, there are just certain things as society we need to do, right? We need to make sure we have seating that accommodates people, right? We need to make sure that when you go to the doctor's office that there's a gown that fits you or a blood pressure cuff that fits you. We gotta make sure when you go to the hospital there's a bed that you can fit in. And we're seeing that is improving. I will tell you that we're seeing that improve pretty dramatically. I used to get stories about us having to, take patients to the zoo to get an MRI or to get weighed on the garbage scale because you don't have to step up on it and things like that. And that's changing. And so we're seeing improvement in those areas. And by the way, if you ever meet someone who's struggling trying to find, especially imaging, which is still trying hard to find for imaging, just reach out to us because we work with all the organizations. We know where the larger imaging sites are so we can get people the care they need and they can get treated with dignity and respect. Because I guarantee you that if you go to the provider and they say, hey, my only option is to take you to the basement and weigh you on a garbage scale because we don't have a scale that accommodates you, you are never going back to the healthcare environment, right? And then you get caught up in this cycle of, you're not gonna get the care you need, and that does real harm to people.
Yeah, wow, unbelievable. Wow. So what is your hope for people living with obesity for the future?
Joe and I were talking a little bit about this yesterday, and off the cuff, the first thing that came to my mind was safety. And what I mean by that is the same thing I want for my daughter, right? I want her to feel safe being in the world. I want her to feel safe expressing her ideas and opinions. Sitting up on a stage in front of 250 people is, a little scary for some people. But if I lived in a larger body at this moment, I have a history of obesity and have obesity now, but my body looks like this. It's somewhat normative and accepted. If I lived in a different size body right now, I would be more nervous being up here, especially talking to you about obesity, right? Some of my patients are physicians who live with obesity. Do you think they address obesity with their patients? Not always. Why? Because they think, why would anyone listen to me? I don't dare say that. So I wish for safety for people to feel like they can be themselves, share the education they have and other things without fear of judgment.
I'm going to pick up on what Robyn said there before I add my own comment, but I think that the providers who have their own personal experience, I will tell you that 2 healthcare providers have led me towards better health when it comes to my obesity, 2 that stand out to me. And both of them had their own personal experience. And it was actually a provider who could relate to my experience, understand my struggles. She shared, well, you know what, Joe, when I was going through, this is my experience, and then she created a bond with me that led me towards better health. So I know providers have that fear, but for many of us, it's actually the connection that lets us move forward. My hope moving forward is that, we will really treat obesity like a disease and that it'll be okay to ask for help. My hope is that we live in a world where, if I woke up today and decided, you know what, I heard what my doctor said previously, I heard what everyone said to me, that I really need to address my obesity, that I could go to my provider, that they would be trained, they would understand how to do this, they would have a lot of options for me, we would go through a shared decision-making process, and then I could get that care. But I will tell you what happens right now. That model doesn't exist. There is no one person who can guide me about all my options. If I see a dietitian, I get dietary counseling. If I go to a surgeon, I get surgery. If I go to a doctor, maybe a 5% chance now they write me one of these new meds, but 95% of the chance they just wag their finger at me. We have to change that. Right now, people themselves have to find their care. And look, I'm all for, as an individual, you be the center of your care, but you should be guided. This should be like when you get diagnosed with cancer. If anyone here has ever had a diagnosis of cancer, you get a binder, right? You have a navigator who walks you through that. They talk to you about every option from no treatment, which you could choose to do, all the way through the most aggressive surgical interventions. But they guide you around all your options instead of making you sit there and figure it out on your own. But with obesity, we have to figure it out on our own, and people, unfortunately, are taking advantage of that, right? And we see a lot of snake oil and malarkey out there, right, kind of thing, and that's the world we live in. In fact, one last comment to me on that, and just worth acknowledging. I had a college professor, it's a marketing class, and it's amazing the things you remember from college. But he told me, hey, we're gonna market this product, and it's a miracle weight loss pill. It's not gonna be real, it's just gonna be a sugar pill, but we're gonna promise people double their money back. And everyone in the class is like, we're all young, naive, we're like, you're gonna lose your shirt, right? Everyone's gonna ask for double their money back, you're gonna lose millions. And he said, no, we're not. We're gonna make a fortune. Because not a single person will ask for their money back. Because they're gonna believe it's all their own fault that it didn't work, not that the product didn't work. And that's what we have to overcome. We have to make it a world where I don't fail a treatment, the treatment fails me. And by the way, that's no offense to any of the treatments you guys are providing. There's plenty of treatments, there's plenty of people who these GLP-1s aren't meant for. But that treatment failed them, they didn't fail the treatment. We have to change that, we have to change society's view to say the treatment failed them and let's move on to the next one. And not let people blame themselves for not being able to address their obesity.
Yeah. Well, Robyn, Joe, thank you for providing your insight with us today. I know we'll see you both later.
Yes.
During this program.
Yes.
Can we have a round of applause for both Joe and Robyn? Thank you.